there. We are here to do just very brief video to summarize a very brief prenatal visit with exam. Usually you should review your chart on touchwork and the prenatal record before you see the patient. And when the patient is ready, you will find this chart on the door. And the chart usually has the gestational age and the blood pressure, the weight, but they are also on the computer. So you are going to go inside the room and see the patient as you'll see in the video. And after you finish, you're gonna find this blue sheet for the next appointment. And typically for your Thursday stroke clinic, there is a Thursday stroke that we circle here to tell the patient, and then we write next to it, when do you want to see the patient back, in 2 weeks or 4 weeks or 1 week, and that after discussing with your attending in this clinic. We are here in this exam room to do a simple and brief OB exam. The first thing is we need to find measuring tape. Usually in our OBGYN clinics, in one of those drawers, usually the second drawer, we have this measuring tape. So you will bring one of them out of the drawer. This is one, and we will use this to measure the fundal height. Second, we use this Doppler. This is a Doppler, and this is on and off. Most of our Dopplers, they give you the numbers, the heart rate, and on the side of the Doppler, you'll see this that can lower or increase the volume. So keep the volume up all the way, then you can hear. So with this Doppler, you need to put gel before you put it on the abdomen. With this gel, you are ready to go and put this on the abdomen, and it chooses the spot that is best to get the heart beats. I've seen a patient in her 3rd trimester, and we are going to do a basic OB exam, which includes fundal height and doing Leopold maneuvers and listening to fetal heart tones. We start with the 0 here on the pubic symphysis. Make sure you go on the pubic bone, don't go on the belt line because they are different. So feel the pubic bone and then apply the 0, not 1 or 3 centimeters. Use the centimeter, not the inches. And then with your left hand, you hold the measuring tape this way between the 2nd and 3rd finger, and with the 5th finger, try to feel the fundal height. If you push down, you can feel the fundus of the uterus, and then without moving your 5th finger on her of her abdomen, you bring the measuring tape down to you. So I have here 37 centimeters. So we start from 0 here. Common mistake people do, they lift their hand and then they do this and they get inaccurate measurement. So instead, go here, feel the fundus, and drop the measuring tape toward you, and you get 37 here. This is the first step. Number 2, we need to feel the position of the baby. So one maneuver is simply trying to feel the head. Between my 2 fingers, I feel the head here. I'm shaking the baby's head. This is number 1. Number 2, you can feel where is the butt, and I am cupping the butt of this baby that is here with my hands. Third, you can feel both sides to see some people have more solid feeling here and more soft here because the baby is sitting on one side. I think both sides are equal, but if it seems to me that this is more hard than this one, because next we'll be listening to the fetal heart tones. So since we are 3rd trimester, the easiest way is to imagine an X. The head is down, so the chest will be somewhere here between the head and the belly button. I believe the heart is here because we have, it's more hard here, but in 3rd trimester you can get the heart 1 inch from the belly button here or 1 inch here. So if you think of an X, I'm gonna go here and see. So we can hear, we listen for a minute at the most is enough. I get 142, 143. The heart rate is regular. I don't hear any arrhythmia. It's normal and healthy to have different heart tones, that it jumped up from 140 to 146. And we are good. And we are going to do a group B streptococcus bacterial culture test. We usually do this on every pregnant woman around 36 weeks. Sometimes we do it earlier if needed. It's very simple. We have this kit that has two swabs, most of the time two swabs. It can be one swab only. And this is a container tube, so we have to take the cap off. And when we move to the patient, we put the patient in like a frog legs. We don't have to pull the stirrups. We don't have to do speculum. You don't have to bring the light or sit down. You can be standing up, and the patient put her heels together and her knees apart, and you will go, and with your left hand you are going to spread the labia, and the top one has to go 1 inch inside the vagina, the outer third of the vagina. Make sure when you put it inside the vagina, you go to the posterior aspect of her vagina and do not hit the urethra. Some people can put this inside the urethra and that can be painful. So you go on the posterior wall of the vagina, you go 1 inch and you give it just 3 seconds. And the second head, you just swab the perineum and then you are done. It's only 5 seconds, and then you put two heads together inside this tube. And this tube has to be marked with a sticker that has the patient information, and the nurses will take it and send it to the lab. It's important when you do this test, we ask the patient about their allergy, especially to penicillin, because penicillin is the main treatment for positive group B streptococcus intrapartum. And if the patient is allergic to penicillin, it's important that we mention this to the lab, then they can run susceptibility tests for clindamycin and erythromycin. So it's very important when you do this test, you ask the patient if she's allergic to penicillin specifically and what kind of allergy to it does she have. Thank you.